African American, 58% countywide. I wonder if you could share your thoughts on that and what can be done to drive down those numbers.
Well, we're going to be holding a press conference a little later today at 1 o'clock to specifically address it. But it's devastating to see those numbers and knowing that they're not just numbers, they're lives. There's families and communities that have been shattered. That's why we will be announcing a very robust and immediate comprehensive plan to address this. But we also have to think about this in the context of really what the Chicago Department of Public Health has been saying now for years. We have equity and health access disparities all across our city, and particularly in Black and brown neighborhoods. We know the problems of diabetes, of heart disease, of respiratory illness are really prevalent in communities of Black and brown folks. We know that access to health care is a similar challenge in a lot of those communities. And so this disease that is just ruthless in the way that it attacks, that is why we've been saying from day one, the vulnerable population, seniors, 60 years and older, and even more acute at older ages, people with underlying conditions, they are the very vulnerable populations that we've been talking about since the onset of this pandemic, and with good reason, because we knew that they were going to be the ones that were most at risk. And unfortunately, the data has proved that out. Now, I'll say more about this later, but this is something that is a public health red alarm that we have to make sure that we are stepping up as a community to address it.